sectors. I think the first one was from the financial services sector, or rather the super boards. And then today we are really excited to bring together such a diverse pool of leaders in the health sector, but from different backgrounds. So this event is actually organized by the Cyber Data Risk Managers. Thanks to Mina Wahi who put this together. And I am your host for today. My name is Charmaine Tan. I'm the Chief Growth Officer at Privasec. So I'm very excited to have with me a great panel. And what I'm going to do is do a quick introduction of who we have, who is joining us today. And it'll be good if you can just share a quick highlight of your career history, maybe just a couple seconds, to just give people a better introduction to who you are. So first up, we have, I'll start with Mina Wahi, you're the organizer. Maybe you can give a quick run through of what you have achieved and a bit more about yourself.
Yes, thanks Charmaine. We are specialist insurance brokers, so we look at emergent risk and try to help our clients identify risks that are emerging and source insurance policies from them from all over the world. So we work very closely with London underwriters. We source best practice from the US. We work very closely with local underwriters, and we're constantly demanding that we tailor make their policies to suit our clients. So we specialize in emergent risks, which includes cyber risk, intellectual property risk, telehealth, e-health risk, and also reputational loss.
Excellent. Thanks, Mina. And I'll move on to Ami Asigao, who's the director at Practice Partners. Go for it, Ami.
Thank you. Yeah, so as you said, I'm a healthcare consultant at Practice Partners there, and we work with our clients on a number of different fronts, but we work in coaching, mentoring, GP specialist, allied and dentist on how to run, start up, grow or exit their practice. And along all of those phases obviously is different risks, and now obviously as we're facing whole new risk, and it seems to be diversifying and innovating and changing all the time. So, and different risks come from HR to financial, operational, marketing, growth strategies. So we're working on those lines, and I'm also director of my own medical centre group as well. So we're also opening up our own sites in this unprecedented times, as we all say. So that carries its own risk as well, and trying to mitigate that.
Excellent. Thanks, Ami. And on to Leonard Ong. So he's the APAC region CISO at GE Healthcare, and he's the only special one joining us from Singapore. So it'll be interesting to hear his perspective of Southeast Asia market later on. So go for it, Leonard.
Well, thanks, Charmaine. We're glad to be here. As Charmaine introduced, I just started with GE Healthcare, and prior of this, I was with the MSD International, or in the US they call it Merck, it's a pharma company. And prior to that, I was with the bank and as well with the telco industry. And if you're old enough to know Nokia, so I was with Nokia for about 11 years, and glad to be here.
Thank you so much, Leonard. And on to Mitra Minai, who is a CISO at HealthScope. Mitra.
Oh, thank you. Yep. So Mitra Minai, I'm the Chief Information Security Officer at HealthScope. I joined HealthScope in December of last year, so just under 10 months. We've got 43 hospitals around Australia. We've just sold our pathology business in New Zealand. And I come from the financial services sector, so 12 years in financial services and before that in professional services. It's certainly a very different industry and environment to have joined, but really loving it. It's been a great experience so far.
Wow. Yeah, and then I think having that nice blend where, different industry adjustment and all that, that'll be quite interesting to hear your views later on. And finally, Gavin Foxman, welcome to the show. And, he's the board chairman for End Health. He has extensive board experience in the health sector. So Gavin, it would be great if you can introduce yourself.
Yeah, good afternoon, everybody, and or good morning, depending on where you are joining us from. Leonard, I am actually old enough to think Nokia was pretty exciting. So, I've spent my entire career in the medical technology space. I spent a major part of my career at Johnson & Johnson, ending up being the managing director for Australia and New Zealand, and finishing up as a regional vice president there. I've currently got 2 or 3 board roles. And Health is the most interesting one at the moment in digital health. And Health really is about helping digital health startups in Australia commercialise. So very pleased to be here today, Charmaine.
Thank you so much, Gavin. And with that, we're just going to jump straight into quite a lot of questions that, the audience have prepared for us. And also just a quick one to the rest of the listeners who have joined in, right? If along the way you feel there are questions, burning questions you want to ask, feel free to type them in the chat box, and we'll try to get through as many questions as we can during the Q&A segment later on. So on to our very first question, right? Because we want to know, as risk emerge and cease, how are the boards of the health businesses looking at risk that shall become dominant over the next 5 years? So if we can start off first, maybe hearing from Gavin and Ami, if you can highlight some of the emergent risks and challenges before the health board in managing them, that would be great.
Okay, Ami, I'll jump in first if that's okay.
All right.
Well, I think my first comment on that question is I would be very wary about looking at 5 years. I think 5 years was always a long time. 5 years in the current environment is an absolute eon. And so I think the first thing is all boards, all leaders need to reframe what is long-term planning. And therefore, you need to understand what those risks are, maybe in the shorter term than we've ever looked at as senior leaders. And I think that is probably the biggest comment I would make there. I think one of the interesting things that we can explore, particularly with a health filter, is, and particularly maybe in health technology as opposed to health services, is the tremendous growth that we are going to see in health technology and its interconnectedness. The biggest risk that I see there is that the technology advancement will get ahead of processes and risk. And that means companies are going to they may end up with great technologies, but they've got to make sure the underlying processes and support mechanisms of that technology, particularly if it's patient-oriented, and particularly if it is around patient data, if it is around dealing with healthcare professionals on the front line, and I think Ami can make some really insightful comments there. But so for me, 2 comments. I think 5 years is a long time in the framing. And secondly is we are going to see tremendous growth in health technology, and the risk associated with that tremendous growth will be, will we have the right processes and underlying mechanisms to support that?
Very good point. Ami?
Absolutely. Yeah, look, I couldn't agree more with the 5 years. When I set up the last one, someone said, "Oh, can you even do a forecast for year 2?" And I was like, no, I can't. No. Because, I mean, for instance, Medicare billings in the end of the month, we're going to be hit with an absolute question mark on what is and is not there. How long we've been waiting for telehealth to come in. And then when it came here so quickly, and then we don't know what that is. And a lot of people have changed their whole businesses, 5-year plans, to have that in them. And that's going to have to change. So because of that consistent change, it is about consistent communication and consistent monitoring and revaluing. Well, what is my risks now, and what can I do to mitigate those now, and what are the expectations? And there's 3 types of expectations we always have a look at. Is patients' expectations, and that comes into that IT tech a little bit too. Is the patient expectations at the moment have changed dramatically. They're getting used to this telehealth and they're really liking it. Now it might get pulled at some point in time. They want to see that people are getting communicated with. And the old coming into a GP practice now, that whole thing has diversified. So what are their expectations now? What are they likely to be when we're seeing some other changes coming into the market with the IT tech, the changing in MBS item numbers, the expectations of staff? Homeschooling's come in, people are working from home now. There are a lot of people that probably won't go back to work. What is that happening? We're seeing a lot of nurses not wanting to do as many hours. We're seeing that front desk staff can't do as many hours either. So how does that hinder the business? And how can we make that part of the practice more efficient to cope for the less amount or the less expectations? So then we've also got the doctor's expectations. Okay, so they've been doing telehealth in their lounge room. You know, they're not wanting to do specific hours. They want to do exactly what all they can do with the smallest amount of movement. So we've got those 3 expectations we've got to manage, but we've also got to manage the expectations of our board and anyone that's invested in our stakeholders. So there's quite a bit of expectation there. So I would try and break that down, and we've been breaking it down, especially in Victoria, every month, because it's changing all the time. But I would start to look at, 12 months maximum, with those highlights of things like the end of the month when we don't know what's going to happen with Medicare, because there's going to be some real changes. And another thing I'd like to bring in there too is the risk on audits. There's going to be a lot of audits coming in soon, because we've had that huge change of Medicare coming in, Medicare changes, all those expectation changes. Audits are going to be a big thing, and that's a huge risk for both the practice and the GP. So having a look at those 2 areas or 3 areas there, that they're probably the things that I would look at first.
Thanks for sharing that, Ami. Maybe Mitra and Leonard, do you want to give it a crack in terms of sharing it from a different lens?
Yeah, I can probably give it a try. So I think it's quite interesting what Amy and Gavin has mentioned, right? So for example, in my previous organization, we had telehealth launch as one of the to-do lists. And because of the COVID pandemic, and it just shoot up to the #1 priorities, and we basically spin up the service in a couple of months. So I think as part of the challenges for CISOs is really to ensure that we don't take shortcuts, and we make sure that the system are properly tested, because it's very different than having a patient walk into your clinic, and it's pretty secure. It's a physical interaction. Now that everything going through untrusted network, and there are a lot of ways that go wrong there, right? And we also see that some organizations are implementing telehealth as easily as using a WhatsApp call. And to me, that's probably not the best way, because there is some implication on it. And I just want to quickly touch base on the second thing. I think it's correctly pointed out, yes, I think things are very fluid and it changes the business priorities. But what I would like to also give put up a seed for thought is that the medical data analytics. So when I speak to one of the CEO of the large hospital here, one of his thoughts is that how do we analyze all this medical data, for example, in order to treat a normal cold? The different doctors will have different prescription, different techniques, dosage, and so on. But what actually works the best? Some doctors will overprescribe, some will underprescribe. But what is the really the best spot there? And in order to do this, we need to do analytics. And when it comes to analytics, there are a lot of concerns like the data protections. There's a cross-border data transfer, the ethical use of the data. So I think that's something that I've been grown to interest on looking at it, because securing data is not easy. But I think enabling innovation analytics is even harder for this point of time.
Absolutely.
Thanks, Leonard. Maybe Mitra, you can kick off with the next question, because we want to find out, your observation, right, when it comes to regulators such as the OAIC, AHPRA, health boards, right, and all the other regulators that are imposing guidelines right now and greater responsibility on their health businesses. Maybe you can share and walk through your approach in dealing with any of those challenges.
Yeah, absolutely, Charmaine. So actually, HealthScope had a review done by OAIC a couple of years back in terms of, how robust our control environment might be and effectiveness of our controls in managing data privacy, especially patient data privacy. And so, of course, like any business, we grapple with that sort of the balance between the business value and providing the right solutions and meeting the business requirements versus actually keeping that, the patient information safe and protected at the same time. And so there are always going to be sort of, I suppose, lots of work and lots of initiatives that need to be rolled out across the enterprise to really uplift our maturity and capability in that area and do things the right way. So we don't ever want to be, I suppose, from a security perspective, ever a roadblock to what the business is trying to achieve, and especially to give that end, the health service to the patients. But they just need to be doing it the right way with the right sort of solutions, whether that's, through data encryption, whether that's through password protection, and lots of other things that we're thinking about, which is just basic hygiene that they need to think about when they interact with people outside of the organization, when they interact with the patients. And it's really about awareness and training, right? Because we've got a bunch of professionals, medical professionals who shouldn't necessarily have to worry about security. They don't need to really, we should enable them with enough tools and solutioning that they can get on and do what they need to do. But it's my job to make sure that they're doing it in a secure fashion. So really it's about making them aware of what their role and responsibility is specifically within the business and what they need to be doing, but also arming them with the right tools and solutions so that they can do it the right way and they don't cause data loss issues that really OAIC, like the OAIC and other regulators are really worried about.
Yes, that's a very important point, Mitra. And Gavin, is there anything you want to add to that?
Yeah, look, I think it specifically relates to the health side of things, and that is when we talk about regulators, there are all the regulators every other company deals with, but then there's a whole level of health regulator as well. And I think whether you're a health technology, whether you're a health service, whether you're a health provider, first of all, you need to be aware of all of the regulators. And I think Amy touched on it there around the audits that are going to be coming through. Now, you can be audited by a number of different bodies. And I'm sure many of you are on the call, were familiar. There was a recent finding against a company called Health Engine in Australia. And it was a case brought by the AHPRA, which is our anti-competition regulator. And it actually went to federal court, and Health Engine got fined nearly $3 million Australian dollars for both sharing patient information and secondly, changing patient reviews of their services. So again, 2 points. One is the regulators are not just the normal regulators that any other company deals with. There are health regulators as well. But secondly, those regulators are active. They are looking for breaches and they are penalising those breaches. So it's a real area of risk management for health companies and health boards.
That's interesting that you share that, Gavin, because it was also in the news that one of the healthcare facilities in New South Wales was compromised in a recent cyber attack as well. And that was something I wanted to ask regarding to that. But before I move straight to the next question, I see like Ami nodding, and I don't know if any of you want to jump in and add anything as well. Feel free to go ahead.
Yeah, I think just something to add is that a lot of practices or healthcare business are confused on who the risk lies with. When it comes to audits and different things, they'll say, oh, well, it's the doctors. Oh, no, it's the practices. And surprise, surprise, it's both of you. So, and if the receptionist does it, it's got nothing to do with me. Or if they send that email to that patient, then it's got to do with the receptionist and that's got to do with the practice. Well, that's not the case. So I think sitting down as a practice overall and going through what's at risk and the policy and procedures, because we do have, again, we talk about that ever-changing nature and how we were shunted in. Leonard, you brought in that it just all of a sudden it was brought to your number one priority to get telehealth in, and that's when mistakes happen. That's when everyone goes, all right, we'll just pick up the phone and talk to a patient, or we'll just get on a WhatsApp call and talk to a patient, which is great. You're moving on your feet. However, we need to step back and have a look at, well, what does that mean for the front desk? What's the flow of the patient? Do the patients know what to expect when they come in for that, and what they can and can't ask for? What can and can't send? We need to know all those things. So just don't be, I guess, too close-minded to know that the risk actually lies with all of us, not just the practitioner or the practice, really.
That's good, Ami. Question to Leonard and Mitra, because we talked about earlier the health facilities, being compromised, right, in cyber attacks. What happens in the event when there is an attack and then there's growing concerns of leaked patients' data that's maybe circulating in the dark web, right? What advice can you give to companies of what they can do to limit the damage and maybe help rebuild and regain the trust of their customers again?
Mitra, would you like to try first? Then I'll jump in later on. Thanks.
Yeah, sure. So look, I think it's a matter of when rather than if any of our companies, unfortunately, get some level of compromise, because certainly the cyber criminals and cyber hackers are a hell of a lot smarter and very highly financed group of individuals. So I think, unfortunately, unless every single perimeter security and every single control is operating at an optimal level, 100% effective, you're never going to be able to say that you won't get compromised. So what do you do when you do get compromised? I suppose the key thing is to be ready, right? So you need to make sure that you've got a well-documented and rehearsed cybersecurity incident response plan, that you've got all the key stakeholders up to date with exactly what their role and responsibility is in the unfortunate event. And I keep saying to my board, not on my watch, right? And I hope not on my watch. But if it does happen, you need to have the different levels of stakeholder groups and the decision makers well versed in exactly what it is that they need to be doing. We need to have the right tools and solutions in place to really identify that vulnerability or the threat that's materialized in our environment as quickly as we can. And so there's a level of investment and prioritization that needs to be made by the board, by the investment committee on, what is it that we really need to bring into the organization to be our eyes and ears and have the effective monitoring controls in place to really identify a potential vulnerability. And then how do we contain that as quickly as possible? Again, through different solutions, through different setups, secure by design, segmented networks, and so forth. I could get really geeky here, but I won't. In terms of exactly what you need to do from a technical perspective to make sure that you contain any kind of threat or vulnerability that's materialized in your environment, and then how do you recover very quickly? So, whether they've been able to take one patient record or 10 million patient records out of your environment. Obviously, it's a risk-based approach on how you manage that, but you need to have your communication and marketing and corporate affairs and so forth areas as well involved, so that they can provide that appropriate advice on how to deal with it, minimize the reputational damage, minimize the financial loss, and be able to recover your systems very quickly if you have had that unfortunate, say, ransomware attack that might have happened in your environment. So, yeah, readiness. I think, there's not enough practice these days in terms of really revisiting and rehearsing your incident response plan and making sure you're ready for anything, any scenarios that get that may materialize in your environment. Leonard.
Yeah, I think that's a very good point, and I just would like to add a couple of more points. So, for example, I'm actually very concerned about the standalone medical clinic or the small network, because the cyber risk actually has increased since March because of pandemics multiple fold, and we have seen that. And it is surrounding the theme of COVID-19, which all of us could relate to, and therefore all the social engineering has been more effective than before because it is related to everybody. And I think if a large organization or like hospital are still struggling with the protection, with the controls, and we can imagine about a smaller network of clinics or standalone clinics, right? They definitely are not empowered to deal with the same level of cyber threat that everybody else is facing. So I think that's something that we have to work together as a community. And I think secondly is that we need to understand our contractual obligations. And sometimes when we have a corporate clients, somewhere hidden in the contract say that if you have an incident of this size, you have to notify us in half an hour, right? And when something happens, typically you are scrambling and you don't even remember that you have a contractual obligation, right? So I think it's an ongoing journey. I think we have to do this together with the authorities and as well as in the community, but definitely not something that we should do by ourselves. And if I can just add one more point, this is also important to have a cyber insurance, right? I'm not sure that Michal will cover that, but I think it is really important because the cost of the cyber threat will be good because you kill the business, right? And this is where you need your insurance to come in as well.
And that's a perfect segue into Mina.
Charmaine, can I just make a comment? Just a couple of weeks ago, the New South Wales Stock Exchange had a a distributed denial of service issue. They had an attack at the end of August.
Yes.
And one of the first ministries to issue a briefing paper was the New South Wales Ministry of Health. And so to Mitra's point and to Leonard's point, that whole being prepared. And I've actually checked with the Ministry of Health. What I can do is I can send this document to you, and they have agreed to share it with all of the participants on the call. So it's a very practical, be prepared. This is what you need to look at across all of the New Zealand health facilities. So it's actually, you know, what Mitra and Leonard said actually happened in New Zealand, and they tried to mitigate it as best they could through the health system.
Oh, that's a good point. Thanks for sharing this, Kevin. Okay, and on to Mina. We talked earlier, Leonard mentioned about cyber insurance. So that's an interesting bit, right? So if you can take this question, Mina, and talk through maybe how are insurance policies responding to some of the risk that's been identified by the panel so far, and maybe if you can also share your own observation on how cyber insurance is evolving.
Yes, thank you. So a couple of points were made, and Mitra said something about reputational loss, contractual liability, and very important point about having controls in place. Actually, I like to say that cyber insurance is all about residual risk. As insurance brokers, we are very keen to see that businesses have the right controls and measures and hygiene in place, and we ensure the level of the practice, Amy. So the point is that, you know, we do cover insider threats, we do cover reputational loss, but it's all about the practice, the business who we insure, and all your risk, you know. And it might be that you are outsourcing data storage to a third-party provider, but it's still your risk, and you are liable to the Privacy Commissioner. So we would ensure that third-party risk is covered, and we won't say that, oh, you know, it's the data was breached by a third party, so they ought to pay you for the notification cost for breach of your data. It's your data, we cover you. Doesn't matter where you're holding your data. The other thing is that we are now, as insurance brokers and working with insurance companies, I can say that policies that are coming in from overseas are mindful that reputational loss leads to loss of contracts. So if you're working with other providers and you are holding their data, but you end up losing critical clients, and loss of clients and loss of customers can be quantified as loss of profit. And we are mindful that a business who has lost clients is likely to also lose profit, and therefore that loss of profit is offset. So it's a good time to revisit in cyber insurance because the policies have evolved. Supply chain risk have been included in the risk, the definition of risk ownership and risk liability. We have included reputational loss, and there are a lot more clauses under business interruption which are valid, and rightly so, as you all agree that, you know, the cost of a cyber attack is much too much for a business to take on, and self-insurance is very expensive, and therefore offsetting the risk of liability, the cost of liability and the cost of risk is a business decision, you know, that has to be made. But it's all about residual risk. So Mitra, you're right. Having effective controls, working with the CISO, even having the conversation at the level of the board is so critical, because before you invite your insurance broker to come in, and even like, you know, with the practices now, telemedicine and e-health coming in, I mean, we are sourcing policies that combine technology liability, which is your platform, errors and omission, which is your professional indemnity, and cyber, all combined in one. So we can, you know, anyone who's using a telehealth or an e-health platform or medical technology to dispense a health service can avail of a policy that covers cyber, technology liability, product liability, and errors and omission. I think that's a great evolution of cyber insurance as such. So good things happening there.
No, that's good to know the growth as well and the adaptation of this industry too, right? Maybe a question to the panel, the rest of you, like from your observation, do you see that you get multiple reinstatements on the policy and coverage for emergent risk, such as the digital supply chain risk? And how do you guys view cyber insurance as a risk transfer mechanism? What are your thoughts? Free for all.
Yeah, so look, with us in a medical centre space, I mean, one thing I'm seeing, and with my clients, I'm forever reviewing insurance policies. So Mina, I might have a few to throw your way. But they're always under the impression that, or the IT company does it. So we've got an IT company, we sign a contract and they'll handle it. So that seems to be the wide variety. Okay, well, we've got HotDoc or Health Engine or whatever we've got, and they handle it. So it's interesting, Mina, you're saying that. I'd love to get some more information, maybe do a bit more on that for my client base, because I think that is widely thought of as being the norm. Where cyber insurance, give it 2 years ago, no one really talked about it. It wasn't something that was really widely spoken about. Now that we're doing a lot more online and there's a lot of tech coming in, as Gavin was saying, that people are now starting to go, oh, actually, and again, that expectation of patients have changed. So people want things now. They want to have full transparency of their healthcare. They want copies of their records. They want all of these, they want their x-rays to take home. They want their path results sent home. So, gone are the days of just flicking them an email and off it goes. So I think, for us, it's about having a look at what you have had. Don't expect that what you had 5 years ago is exactly the same now, because there's a whole lot more going on right now. So review is my biggest thing.
Thanks for that, Ami. Anyone else?
If I can add, probably cyber insurance is quite a new thing, and I think the industry it's shaping up, but I think it is growing at a different pace in a different part of the world. And back in 2017, when one of my previous organizations suffered from a major cyber incident, we did try to activate the cyber insurance. And one part of it is to prove that you have done all the right thing in terms of your preventive, detective, corrective control. At that point of time, then you could so-called seek for some kind of coverage from the insurance. And I think that would be one of the difficult thing, because in a traditional insurance, if something happens to you, as long as it's not malicious, it's not a fraud, you will get the compensation. But I think in cyber risk insurance, you have to prove that you have done all you can and there's nothing else that you can do. And I think that's a data on it is still being collected. I think it will take a while until we see a consistent sort of practices and ratio statistic on the cyber insurance.
Thanks, Leonard. So we've covered quite a few emerging risks earlier, but what are some of the best practices that the rest of you might have seen in the health sector when it comes to dealing with risk and liabilities that specifically comes with like technology errors and omission in telehealth, like we talked about earlier? Some other examples such as self-monitoring healthcare devices, e-health services, to mobile health apps, remote patient monitoring tools. There's a long list, but yeah. Maybe if y'all can share what are some of the good practices we can learn from. Maybe Gavin or Mitra, you want to go first for this?
Yeah, sure.
Mitra?
I can go ahead, Gavin.
Sorry, Mitra.
No, Mitra, you go ahead.
Yeah, Mitra, go ahead for this.
The joys of remote. Yeah, look, I think, from our perspective, obviously, we've got quite a diverse group of hospitals across Australia, and they've got different needs and requirements to meet the patient's care. And so, with that comes challenges around Internet of Medical Devices and various things that really the general managers of our hospitals want to purchase specifically for the key care that they give to the patients in that particular hospital. Again, to my earlier point, they don't think about, well, that, Internet of Medical Devices or that medical device is digitized, or it might have a, chip in it, or, that we're then connecting that to the network and what kind of risk or exposure we might be introducing into the environment. Again, it's all about that awareness and training and working with the business to really understand their operations, their key processes. What is it that, the new age kind of technology, and we touched on, I think, Gavin, earlier on, you talked about health technology and, how quickly we're moving towards this digitized platform. So with that comes heightened risk, obviously, but how do we manage that, and how do we ensure that, for instance, in my own example, any of my general managers across my hospitals bring on medical devices, that they get my team involved in reviewing that medical device, making sure that it's got secure by design, privacy considerations, and so forth. So the moment we turn it on, it's, first and foremost, it's about the patient health and patient life and death, right? So if there's medical devices that are administering drugs to patients that can't be hacked and therefore then manipulated, like you see in some Hollywood movies, you've got the appropriate controls in place to stop any of that sort of malicious activity. But also then, those devices, inevitably MRI machines, other things, will then require to be connected to our network so that we can, get all the data of that patient into our systems, and then be able to, make analysis and judgment on the patient's health. So again, what is the exposure there, and how do we, as the security professionals, continue to be involved in the operations and that key decision making across the areas, the various environments, and minimise the risk and exposure.
Thanks, Mitra. Gavin, or Amy, do you want to add to this?
Yeah, do you go, Gavin?
Go for it, Amy.
I think it's a bit of a funny twofold question, because for me, like in assessing risk and making sure we're across the whole practice, is really about data and gaining a lot of that data and keeping on top of all that data. And to do that, we use IT integrated systems, which then create another risk, which is cyber risk. So, it's a funny one that we're monitoring risk by introducing another risk, but we've just got to be across the whole board, and I think look at it as a whole and say, okay, well, where is all that data and the risk that we're looking at? Outline the risk areas for us. We do on a regular basis every quarter. We review what type of insurances we have and different things in the practice there to mitigate risk. That can be financially, operationally, all that data driven. But I guess people do get bogged down, and I have a lot of practices like that say, well, because of this cybersecurity, they feel they're at risk, they stop doing what they're doing and they don't move forward in that age. And I think that's what we've seen a bit with this COVID-19, is that those head in the sand at the moment, the ones that are struggling and haven't set those expectations up, is that they're scared of what's to come. So the risk has feared them a little bit, so they haven't taken on all this tech and other things that are going on right now to transform, rather than make sure you're secure. Speaking to someone like Mina, what they do is they just stop, and that's actually creating more risk for the business overall, in a sense anyway. So I think don't be scared to take on a little bit of new tech that might look like it's creating that risk, but just make sure you're covered in that, and have a look at it from all angles before putting into a practice. Is my advice.
Yeah, and before we move on to our final question, just open it up to the floor already. Everyone else in the audience listening, if you feel that we have not addressed any maybe other burning questions you might have, you still have a few minutes left to type them in here. With that, we talk a bit about COVID as well, right? So final question to the panel, right? Given that now we are already in COVID, like for so many months, how do you feel like, in particular, the health business deal with the issues of business continuity, loss of profit, retention of employees? Maybe with the hindsight that we have now, what could we have done better? Gavin.
So I have a couple of thoughts here. I think, and let me talk about the health technology side of things, and I'll allow the others in the different spaces to talk about their space. I think the health technology industry has largely responded brilliantly. I think they have been very kind and generous to their employees, and they've looked after their employees well. We have not seen mass layoffs. We've seen very strong pivots to working from home, very strong policies around working flexibly. I've seen a number of both major and smaller companies dealing proactively with employees' well-being and mental health.
Wow.
I think on the commercial side, one of the things that the industry needed to deal with very early on was supply chain integrity, where a number of our products are sourced from overseas. I don't know if anybody saw their statistics of the Fortune 1000 companies. So that's across all industries. The top 1,000 companies in the world, 962 had a first or second level supplier in Wuhan, not in China, in Wuhan. So supply chain across industries was impacted very, very early in the pandemic. So, long answer to say, I think the health technology industry has responded brilliantly. I think there is a lot of nervousness going into the next 6 to 12 months, whether they can retain their revenues and profitability to sustain their cost base. But by and large, I think they dealt very well with the pandemic.
Yeah, that's brilliant, Gavin. And I think our health sector really needs to hear that, because a lot of effort has gone in as well, right, to respond in such a way. So thanks for sharing that and bringing that up. There is a question that came in from the audience, but before we go to that, anyone else want to address my earlier question?
I mean, if I can, I think it would be interesting to always remember that this crisis is applied universally, and it's certainly the most serious that I've seen in my lifetime. And I think it is a reminder that we have to put all hands on deck, right? And this is our common interest. So what that means is that we have to be united, and for business owners, not to think purely on a profitability point of view, but rather more on how do we survive throughout this crisis instead of maintaining profitability. Right, and for all of us, the public, for example, we have to have a responsible behavior, right? Whereby if you are not feeling well, you don't come out. And for the employers, your managers, we shouldn't force our employees to go back to the office. So there's something that we can do in our roles, and I think that's something that I find we need a constant reminder. And for example, on Monday, Singapore is going to distribute what we call the contact tracing token to all residents. So technically speaking, I mean, everyone could have one, and it should be easy to track who has been exposed to individually, who has been confirmed with the virus, right? But that really requires participation from the public, and this is something that I hope we all do our part. And one last example, data protection. As much as we want to protect data, there must be a trade-off here. So for example, one of the requirements to enable international travel, it will be international cross-border data contact tracing. So it's a little use if every government is keeping their contact tracing database within the nation. But if I want to go to Australia, and I should be able to have that, the government of Australia should have data which has been exposed to upon my return in Singapore, right? Or who has been exposed to in Australia. So there must be that kind of cross-border, which could be going to the discomfort because we're trying to protect data, keep it within the borders. But this is probably one of the reasons where we have to look things differently.
Yeah, that's true. And with that, we have our final question from the audience before we ran out of time already. But maybe someone can take this. What is your views on the level of government proactivity so far when it comes to cyber risk prevention, and what kind of regulatory changes do you think is needed in the future? Who wants to take this?
Well, in Australia, the government recently put out the cybersecurity strategy, right? So they've got a huge amount of work happening around, what is the level of investment and prioritization and so forth that they need to make in making all of Australia secure. So I feel like they're certainly, coming along the journey, in making sure that they've got the right, strategy and initiatives in place for a whole of Australia protection.
Thanks for that, Mitra. All right, I'm just conscious we really went out of time, but I really just want to thank all of you for, taking your time to go through all the questions. There were a lot, and we managed to cover a lot of content during this lunchtime, right? 45 minutes. So a big thank you to our panelists for sharing your insights, your experience. I'm sure the audience really benefited a lot today. And some of you join in also later on. And what we'll do is we will share the recording with you when it is out. So thank you, Nina, Leonard, Gavin, Mitra, and Ami for taking your time and being with us here today. We really enjoyed having you on the show. And you know what? Happy Friday. Enjoy the rest of your Friday.
Thank you. Anytime.
Thank you.
Thank you, Charmaine.
Thank you, Charmaine.
Thank you, audience, as well. Take care. Bye-bye.